I'm essentially a caregiver, which means that anybody who's been diagnosed with HIV will passively or actively have heard that I'm the HIV doctor, and they'll make their way to me. So say, for example, if they come to me from a district where I know there's a lot of HIV, or say if any normal person who's never been screened for HIV comes to me from a district which I know has a lot of HIV, I will screen the person who's been unscreened. And the person who's positive, first of all, I'll reassure them this is an infection, it has treatment, the treatment is free of cost, it's coming from the government, but you are bound to come every month and get your new stack of medicines, and you can't be off the medicine ever.
What are the medicines?
So the medicines are actually 3 medicines, and because it's difficult to give children separate medicines, they are fixed drug combinations known as FDCs. For children now, we are tending to give less syrups, less suspensions because they require refrigeration, and we're going towards dispersible tablets. Put the dispersible tablet in a teaspoon of water and you can give it to the child. So easier to give. So Pakistan has never been geared towards child-friendly formulations for children. Parents were always told, suck it up and just give it to the child, no matter how you put it in the child's mouth. But now the WHO and governments around the world are going towards child-friendly medicines for chronic infections like TB, like HIV, where you have to give medicines for a longer time than usual. Okay? So what I do is I reassure them. I tell them, okay, don't worry. This doesn't mean this is AIDS. This means it's just HIV infection, and you have to have certain number of medicines. But of course, other than HIV, we have to do all the things which we have to do for normal children. Nutrition, growth, vaccination, school enrollment, all those things have to be done. Your HIV child will get pneumonia, your HIV child will get gastroenteritis, your HIV child will get flu, will get colds. All of those have to be dealt with like they are dealt with in normal children. But HIV per se, you have to have the HIV medicine all your life.
How many children in Pakistan have HIV in your estimation?
So my estimation may not be accurate, but the truth is that we have populations in HIV. So there's a general population, which means people with standard risk, people who are not indulging in unsafe sex, people who are not getting unsafe blood, people who are not getting unsafe injections. And in that population, the prevalence is very, very low, 0.1%. Okay? But now then there are this thing known as key populations. Key populations are people who have more exposure to risk factors like unsafe sex, unsafe injections, unsafe blood. And in those people in Pakistan, the prevalence is very, very high, 35 to 50% in men who have sex with men, almost 20 to 30% in sex workers, in hijra sex workers, in transgender sex workers, right? And intravenous drug users, which initially were thought to be the driver of the HIV outbreak in adults, they've actually come down. And it's gone up in the sexually transmitted among adults, right? So Pakistan is following the Asian modeling model, in which now wherever there was IDUs, the intravenous drug users were driving they've come down now, and now it's going up in the sexual networks, wale risk factors, wale people. But the point is, whenever, Mahim, you find that children are getting infected and their mothers are not infected, this means that bridging is taking place. Bridging means there's some conduit through which the key populations are transmitting to the general population. Now, whether it's because their spouses are infected, whether they are using dirty needles and those dirty needles are somehow being reused for children, whether they are donating blood and that blood is somehow being given to children who are in the general population, that conduit is not established. Just the fact that we have a lot of children now who are positive with negative mothers means bridging is taking place. This means in Pakistan, children are vulnerable. Even children with negative mothers are vulnerable. And what we feel is that districts which have high prevalence of adult HIV, these are the districts where children are vulnerable.